This is Adrian Laurie with a short little therapist education video about working with trauma and the importance of containment. When I'm working with a client and some trauma comes up, and you can think of trauma in a simple way as basically psychological wounding of a significant enough nature that when it occurred, it was not digestible, and so has sort of stuck with the person. It got frozen in the system, and is still there, causing clients to trip up on things or have anxiety or what have you. And so as we work with a client, and some anxiety will come up, and then some trauma comes up. And what I'll generally say to a client after working a little bit with the trauma is there's no obligation now to continue to process this trauma. That it's perfectly okay and may even be desirable to put it right back where it came from. You're welcome to repress it, and that's perfectly fine. And when it's relevant, we can work more with it, but you're not obligated to kind of keep thinking about it or what have you. And almost always when I say this to the client, as they breathe a huge sigh of relief. The client doesn't necessarily realize, one, that they can put it back down into the unconscious, or two, that it may really be desirable to do so. In other words, the clients think, oh, I'm in therapy, I have to deal with my pain. This pain and aggravation has come up, now I have to keep thinking about it. And really, it's not necessarily useful to have trauma out and about. The repressive mechanism is not a bad one. When something is traumatic or undigestible, the repression allows us to be reasonably clear-minded and move forward until we get to a place where we can digest that experience that was overwhelming at the time that it occurred. So that's a good thing to say to clients in my experience, and we call that containment. Various trauma healing modalities have protocols kind of built in for this sort of thing, so for example, EMDR. But in general, we want the client to know that there's nothing wrong with repression. The client knows how to do it, can do it, may be desirable to do it, and they're welcome to do it. And like I say, clients almost always breathe a huge sigh of relief. They do know how to put it right back down to where it was prior. Sometimes I'll use a metaphor. It's good to have blood flowing freely through the system. But if you get a gash and blood starts spurting out, repress that thing. Press down until the blood stops spouting out. That's going to be better for you. We don't want to repress emotions, but we may really want to repress trauma, except when we're in an environment where it's processable, where it's digestible. For example, with a good therapist. Okay, hope that's useful to you, and more soon.